All right, so sometimes this is what happens. Then I do things that I probably know are not the smartest in the world, and ignore my body. I irritate my back and end up with a lateral shift. Like, this is literally me standing up straight. So significantly shifted to the right, and with a significant loss of, here's dorsiflexion on the right foot, here's dorsiflexion on the left foot. So, lost some dorsiflexion, here's open chain, we'll do to the side. Feels a little stuck. Not from a mobility standpoint, but like physically just can't do it. So, for those of you who don't know, I have 3 herniated discs. I had surgery in 2009. And for the most part, I felt amazing. Like, my body has felt better than it has in probably 20 plus years. And then Sunday, I thought it was a good idea, after a couple weeks of not using my rock mat and just not necessarily making as much time as normal for self-care, I thought it was a good idea to carry a couch down from my 2nd floor apartment into a U-Haul, as well as a desk. So I felt pretty good doing it. And then the next day, felt okay waking up until I sat down on the bed to get dressed, and then also my bag dropped. I was traveling and my bag dropped, and I bent down to pick it up and felt a zinger in my back. So since then, I've had a lateral shift. So did a movement session yesterday, been doing ibuprofen, painkillers, everything I know that's good for me. But here I am, 2 days later, still with a pretty significant lateral shift. So I thought, you know what, this is a great learning opportunity for people to see what I do to take care of myself when I'm like this, and then also when my patients come in like this. So enjoy. I'll try to put some education pieces to it when I'm done. We're here in the Zen Den in Buffalo, New York. Oh. So I'm most comfortable and seated, which is why I start here. I'm going to grab some Franklin balls to work on some pelvic mobility. I start around the sits bones to address the sacrotuberous and sacrospinous ligaments, and then work my way on the inside of the ischial tuberosity to work at the edges of the pelvic floor. The reason I started the pelvic floor is just being in pain in general creates a reflex, primitive reflex called the startle reflex, to tuck your tail up underneath you. Bring your pelvis into posterior tilt in the lumbar spine into flexion, which increases the pressure on the discs. After releasing the pelvic floor, I go through some movements just to see how things changes. Cat, camel. I'm letting the body decide where to go by going into the direction of ease. If you go into the direction of ease, the body, and then listen to it, the body tends to open itself up, honoring the protection patterns. The last thing the body likes when it's in pain, especially, is to be forced in a certain direction. So really, the self-care ends up being pretty meditative, always checking in and having an awareness of how I'm feeling, how my body's feeling, what it's wanting me to do. And that's really how this whole session goes. I don't really necessarily have a plan other than to honor what feels good and what doesn't feel good. And the more I practice this self-care when I'm feeling 100%, the easier it is to be able to listen to my body when it's not feeling 100% and know which way and how to move. So here in prone, I'm doing a hip flexor release with the Franklin ball, rotating my pelvis on top of it and changing the turn out, turn in, and neutralness of my legs to change the different vectors or meridian lines. And then moving into Philip Beach's Da Vinci exercise, creating some fascial tensigrity and some rotational patterns, helping to open up the diaphragm and hip flexors since they work together in the deep frontal line to provide decompression to the lumbar spine. Adding in some prone extension with some full breaths on the top of the extension, using the inhale to create the decompression of the diaphragm on the lumbar spine. Going on the other side, same rocking, and then working into the Da Vinci exercise eventually with both the lower body and the upper body. Making sure to keep both the hands functional reach and the feet in a dorsiflex position. This helps to provide that stability or tensegrity throughout the whole fascial system, so the rotation is in a decompressed spine, which is actually relieving to the disc. I try to press up, but my body's like, nope, can't stabilize enough without pain. So I honor that and work into some sideline hip stability, which actually feels really good. Sometimes I only do one side. Since I have such a significant lateral shift, I just, again, honor what my body wants. Moving into some Philip Beach exercises. Practicing standing and sitting. One of the most painful things when my disc hurts is standing up from a sitting position or getting down to a seated position. Working on some breathing with scapular elevation and depression, activating the serratus anterior, upper trap sling, connecting into my obliques and my lat. Sometimes with low back pain, getting the shoulder blades to move can be pretty pain relieving. Moving into lateral flexion and rotation. Again, going in the direction of ease first, and then the other direction when my body feels ready. Continuing on with the erector exercises. Coming up to a tall kneeling is still pretty uncomfortable and creates more of a lateral shift, even though in seated it's less. So I'm just going through a set of like kneeling cat exercises through Pilates, and then a modified cowboy sit in a kneeling cat, spinal articulation in a rest posture. Widening the sits bones, trying to get my thoracolumbar fascia to create some stability across my spine. That tall kneeling progression was a little bit more comfortable. Trying to do a single leg version because I'm still laterally shifted quite a bit. Now I'm working on the inguinal ligament. I have a ball on the pubic bone and a ball on the ASIS. Add in some hip extension and see if I can't do a form of neural manipulation on myself. And again, I'm just going where the body seems to want to go. Feel the tension across the inguinal ligament. Next, I'm doing a technique on the fascia just inferior to the kidney to try to get the top of the lumbar plexus. Again, a maneuver from a neural manipulation technique. Adding an internal rotation. And then I'm going to move the balls up to my thoracolumbar junction and do a chest lift. And then a neutral spine in the lower spine, so I can come up in a chest lift, get my diaphragm and my pelvic floor mirroring each other, and then when I do an inhale breath at the top, I get a real good distraction of the lumbar spine with concurrent abdominal stability, which then I was able to roll up segmentally and stand up comfortably for the first time all day. Recheck. My shift is diminished, but still a little present. So now I'm going to do a traditional shift exercise in a non-traditional way in terms of going in the direction of ease first and then going over. Try roll down. Down's good. It's on the way up. It's challenging. Just have a hard time connecting into my fascial sling. So then I use my breath, a single nasal breathing to create the lateral shift. Same thing, direction of ease first, and then going to the direction that's restricted. And voila, a little bit of improvement. And even recheck my dorsiflexion. Good side, affected side, way easier, and more range of motion in closed chain and open chain. That's it.